Hello, my name is Robert Shaw. I was going to provide the keynote message at your graduation. I share your disappointment in not being able to wear the regalia and celebrating with your family and friends and colleagues at a full graduation. Part of my job as the Vice President of Examinations with the National Board for Respiratory Care is to make sense of numbers, so I asked the school to provide some. I've learned that the school expects 850 graduates this year. I learned that, again, the expectation is that depending on the program from which one graduates, that 90% to 100% will find placement in a job for which he or she was trained or will continue their education in some way. And so this is a repeated year-over-year event with this high degree of success. And so I wanted to extend my congratulations to the faculty of the school as well as the administration for continuing to fulfill the founding mission of the university as a land-grant institution that puts practical education first. Another point I wanted to touch on was the idea of healthcare workers, providers, as heroes in the current environment of a pandemic. It does not necessarily help, perhaps at first, to learn a couple of weeks ago from the Center for Disease Control that there had been 10,000 individuals working in healthcare who had become infected with the COVID-19 virus. To that, the CDC added the fact that they expected the 10,000 number to be an underestimate because they'd only sampled 16% of the population. And so that number of infected persons could be as high as 63,000. Now, that number sounds like a big number. It tells you that the risk of infection is greater than zero. However, it's not really a true reflection of risk because we don't know what the percentage is. And so I went in search of some information that might shed some light in that area. And I learned with the help of Google that about 11% of the United States population works in a healthcare institution, and so that gives us a denominator of about 36 million, and then gives us a risk that's less than 1%. And so that is I think a better reflection of what some of you will be entering into. I know that some of you will be going onto the front lines and caring for acutely ill folks. Others are going to be working for those recovering from COVID. Others of you will be working in other roles that are supporting healthcare generally. And the key point here is that perhaps you did not think that you were signing up for hero duty when you applied to a program within the school. But you have the capability, especially when looking at that risk percentage, you have the capability of being a smart hero by protecting yourself first, and that's what I'd encourage you to do. I've worked on examinations for more than respiratory therapists. I've worked with transplant coordinators who have a patient population who are immunosuppressed, also in some physician settings, as well as some settings that are outside of healthcare where the individuals are donning and doffing their personal protective equipment. And repeatedly, sort of universally, it is a surprise to everyone at how difficult certain test items can be when the only thing that those test items demand of an individual is that they have memorized the proper sequence for putting the equipment on and off. And so that I want to highlight for you. I'm sure you're going to get trained in this again, but pay close attention and once again, protect yourselves first so you can be a smart hero. Lastly, I'll say congratulations again on your accomplishments, and I look forward to the crucial contributions you're about to make.